Good morning. I am Dr. Abideen, pediatric oncologist and pediatric BMT physician. We are lucky to have Professor Stephan Grupp. He is going to talk about gene therapy in children. And he is a professor of oncology in Children's Hospital of Philadelphia. And he all the way came from USA to talk about gene therapy. So he has been involved in several clinical trials as well as is treating children with different diseases with gene therapy. Professor, would you please explain to us or explain to the common people what is gene therapy means to them?
So first off, thanks for having me here and thanks for inviting me to your meeting. So many diseases in children especially have a genetic basis. So there's actually something wrong in their DNA, which codes for all the proteins and all the functions in your body. And sickle cell is a great example. There's a tiny mistake in the code for one of the proteins that are in red blood cells that carry oxygen. And that tiny mistake causes such devastating problems for sickle cell patients. And we've known about that mistake for 60, 70 years, but it hasn't helped us treat the patients. Gene therapy says, let's fix that mistake. Let's actually take the cells of the patient, take them out of the body, correct the DNA problem, put the cells back into the patient, and hopefully at that point, they will have normal functioning in their red blood cells or in other cells of their body that are abnormal. And so the idea of gene therapy is fix the genetic problem. And we have across the world actually been doing studies in sickle cell disease where we've shown this to be very successful.
Apart from sickle cell disease, is there any other condition in children gene therapy has been used and approved by the FDA?
Yes, there are. So there's sickle cell disease. There's a related a red blood cell disorder that's called thalassemia. That the same approach works for both of those. There are very uncommon metabolic diseases called leukodystrophies, where there are now 2 FDA-approved therapies, and those are devastating diseases that could result in the death of the patient and also very significant brain damage. And so those are now approved by the Food and Drug Administration. A different kind of gene therapy has been approved for the bleeding disorder hemophilia. More than a dozen of these therapies now either given directly to the patient or with cell modifications the way we do it that actually are approved in the United States. They're all quite expensive.
When you treat patient with the gene therapy, do you use chemotherapy?
So if you are doing the approach where you take the cells out, modify the cells and put the cells back into the patients, that's what I do. Because you and I are both cell therapists. We do bone marrow transplant and other cell therapy. If you do that, you need to give that patient chemotherapy to prepare their body so there's room for the cells to go back in. That's correct.
Okay. There are other conditions like spinal muscular atrophy where they don't use chemotherapy, they just give the injection. So what is the difference between these two?
So that's a great question. And so the nice thing about the cell therapy approach is that you only modify the cells that you want to change, but the challenge is you have to give chemotherapy back to the patient. In a disease like spinal muscular atrophy or like in hemophilia, in that instance, you can actually put the treatment directly into the blood of the patient, and the treatment will make the change within the cells that you need. People have done that for blindness. People have done that for the spinal muscular atrophy, for hemophilia, which is basically making changes in the liver. And so you can infuse the what we call a vector, which is the thing that actually changes the DNA directly into the patient. The approaches are very different. The toxicities are very different. The success rates are pretty similar.
Okay. So what are the short-term as well as long-term complication or side effect of gene therapy?
So for gene therapy for sickle cell disease as one example, there are short-term side effects, and they're all not related to the gene therapy. They're related to the chemotherapy that you have to give the patient. So the patient has very typical side effects of chemotherapy: low blood counts for a short period of time, sometimes mouth sores, that sort of thing. And they're in the hospital during that period for about 5 weeks. So those go away. And then long-term, the likelihood that the gene therapy works in a sickle cell patient is over 90%. The pain crises that these patients experience go away. The other challenges of the sickle cell disease seem to go away as well. And this is persistent over years, making us think that the patient may be cured. We're not seeing any long-term side effects of the treatment itself.
Okay. So what about gene therapy is effective both in adult and pediatric?
That's correct. Both in adults and pediatric. The big difference, of course, we're both pediatricians, is the sooner you treat the patient, the less damage the disease has caused to that patient. So if you treat somebody when they're 30 and you treat somebody when they're 13, the 13-year-old has not had the same problems that the 30-year-old has. So any problem that happened before we treat them, we don't fix that problem. We just keep the new problems from happening. But in a younger patient, they will have had less tissue damage and they will be living a completely normal life.
So again, gene therapy is very interesting, and it is been talking theoretically for at least few decades.
Absolutely.
And now practically it is available. How expensive gene therapy is?
Well, gene therapy in the United States is expensive. So the cost to purchase one of these products, the process of collecting the cells, giving it to the company, they do the modification, and then they send the cells back for use in the patient, can be a couple $1 million or more.
Okay. So, when you talk about sickle cell disease and thalassemia, those children or those patients, mainly most of them are living in Africa and Asian countries. How you see that, we have discovered something very useful, but majority of the world population with sickle cell disease and thalassemia, they don't have access. So how you see it, and what is the solution, and how you see in 5 to 10 years time?
So first off, the fact that you can only get this if you live in certain countries is something that I think about a lot, and it bothers me a great deal. So I think that's something we have to fix. Right now, we're at the absolute beginning of this, and I think that we have to figure out technologies that can make the cells more cheaply. And I think there's great opportunity to do this. So the first step is to show in a larger number of patients that you can actually make products successfully, you can do these transplants safely, that the effect for the patient goes on for years, and that we really are curing these patients. They're all very important things, and we're all very hopeful about that. Then we're starting with very complicated manufacturing. Let's make the manufacturing faster, cheaper. That we were able to do that in every industry. You begin to, in the beginning, when you started making cars, it was very expensive to make a car. Now we have automated manufacturing that makes cars much more cheaply. And so this is our hope for gene therapies. Now that we're showing that it works, there's the confidence that we can continue to offer these therapies to patients. Let's do this in a way that costs less. And one of the ways may be for the countries to actually develop the manufacturing capability for these cells. If it becomes more straightforward, more automated, develop that manufacturing capacity themselves.
Yeah. So what you are saying is, in few years' time, it will be more cheap and accessible to many of the patients with sickle and thalassemia.
That's what our hope is, and that's, I think, what we're all working toward. We recognize that we have a responsibility to patients outside the United States.
Thank you very much for your nice explanation about the gene therapy. I'm sure this is very useful for those who are listening to us. Thank you.
Very good. Thank you. All right.